Good evening, everyone. Welcome to the fourth online panel of Building an Inclusive Future Through Collective Action, which is an initiative launched by the North Star Special Needs Society in partnership with York University to advance accessibility, challenge stigma, and support inclusion for people with disability in Asian Canadian communities. My name is Dr. Elena Caprioni. I'm the program director of the Asian Business and Management program at York University. I'm going to describe myself. I'm Italian Canadian. I have red curly hair. I'm wearing a light blue top, and my pronouns are she, her. It's a pleasure to be here with you tonight. It's nice to see a lot of familiar names. I'm happy that you join us again for the fourth night, and you're here again with us at 7 o'clock. I know it's not an easy time because a lot of you are busy preparing dinners, putting kids to bed, but thanks for coming back and stay with us. Before we begin, please note that caption, transcripts, and translation tools are available for this session through the options on your screen. Just click on the three dots and then you can choose the option that you wish. Now, although we're meeting virtually, we have on the screen the land acknowledgement. Please take a second to read it, and then we can talk in a second about this workshop series. All right, so for people who are new who didn't join the other sessions, this workshop series is designed for everyone: parents, caregivers, educators, healthcare professionals, employers, community members who want to better understand disability, inclusion, accessibility in today's society. The goal is to build awareness, empathy, and knowledge across the community with different sessions that we delivered in the last 4 days. As you can see from this visual slide, on the first day, we really were focused on how to navigate the school system. So we try to give different kind of strategies and knowledge to parents, caregiver of kids with disability in the K-12 education system. Then we talk about employment pathways for with youth with disabilities. Yesterday we talked a lot about transition to adulthood, and then we spent a lot of time to explain all of the different financial resources. And then today, as I mentioned every single night, it's time dedicated for parents and caregivers. In the past, in the last 3 days, we always talk about different strategies to help, to support kids with disabilities. But now, today, it's really time to talk about parents, caregivers, and mental health and burnout for all of you. So then these conversations are very important within Asian Canadian communities where disabilities and mental health can still carry stigma or remain difficult topics to discuss openly. So our goal is to create a safe and welcoming space to learn, ask questions, share experience. I want to clarify two important points before we move ahead. I keep talking about Asian Canadian communities. What do I mean when I say Asian Canadian communities? In this series, the definition of Asia includes West, North, Northeast, South, Southeast, Central, East Asia. We follow the definition of the Canadian census. And then I also mention several times disability. So again, in this series, the term disability includes neurodiversity, learning disability, and physical or developmental conditions. All right, so now today's session, Mental Health and Burnout for Caregivers, explore really the rewards and the challenges of caregiving, of being a caregiver or parent. And participants will learn different different signs of stress or different strategies to uh, to build in order to be more to overcome the stress, and also how to build stronger community support networks. So that's the idea. And before I introduce to your two speakers, we want to launch a quick poll because we're very curious to know who we're talking to tonight, and also we want to know what's your knowledge about the different topics that we're going to analyze tonight. So probably you see a poll in front of you. All the questions are together, so feel free to scroll down, but I'm going to read one by one. So the first question is, what best describes your role or perspective in attending this panel? Person with a disability, family member, educator, employer, health or social service provider, community leader, policymaker, general interest. People, don't be shy. Let us know who you are. Then the second question is, how familiar are you with signs of stress and burnout in caregivers? And then you can reply on a scale from 1 to 5, when 1 means not at all, and 5 means very much. Okay, we do have some 4 here, so it's quite a challenge for the speakers to move from 4 to 5. And the third question is, how confident are you in understanding the challenges of caregiving and mental health? Again, on a scale from 1 to 5. And then, how familiar are you with strategies caregivers can use to support their own well-being? All right, I'm going to leave the poll open on the side just in case people can join later. And then with that, I'm going to introduce you to the two speakers tonight, Farah Ahmed and Farah Ahmed and Alan Fong. Farah Ahmed is a professor in the School of Health Policy and Management at York University, researching health inequalities across immigration, race, gender, and mental health. And we also have the pleasure to introduce you to Alan Fong, a psychiatrist and physician lead of the Mount Sinai Hospital Wellness Center, specializing in culturally responsive care and global mental health. Okay, as every single night, the plan is that we're going ahead with a presentation, then we have a quick break, then the second part of the presentation, and we leave the Q&A at the end. But feel free to ask questions and write them in the chat box. And if you want to send it, if you want to write there, fine. Or if you prefer to write directly to me or Mia, our program assistant, please go ahead. Also keep in mind that the session is recorded. So if you don't feel comfortable to show your name, please click on the right side and change it. And with that, I think that we can begin. So please join me in welcoming the first speaker, Farah Ahmad.
Thank you. Thank you so much, Elena and Mia, for introducing. And it is such a pleasure to present about caregivers, their stressors, coping for burnout, mental health, with my colleague, Dr. Ellen Funk. So with that, I think we can begin. And Elena, would you like me to share the slides? Okay, so let me
Yes, please
see.
go ahead, and
Okay.
I'm going also to.
Okay. Okay, so I think we already covered some of our housekeeping stuff, so I'll just move forward to first bring everyone's attention to how we have evolved as a society to understand disability. So up to the earlier part of 20th century, there was not much attention to disabilities, and people living with physical or mental disabilities, they were not given any support programs. There was a lot of stigma and non-inclusive attitudes even at the societal level. Some of them were left outside, even in North American context. They were living in poor conditions, sometimes beggars, or they were some separate houses, poor houses, where they were kept if, society's safety was considered at risk. So those societal attitudes, which were very negative, they started to shift after World War One, when the veterans came from World War One. There were a lot of physical disabilities they were experiencing, also mental stress, especially shell shock they call it, or post traumatic stress disorder is the name that we call it now. And there were psychological impacts. So the government started to develop support programs for them. And after a few years, the people who were living in the gendered society with disabilities, they realized that how important those support programs were. People having those support programs, the veterans, they experience a better health, well-being, and a quality of life compared to people in the gendered society without support systems. So this led to sort of a social movement. A lot of people with disabilities and their families, they bonded together, and they wanted governments to develop support programs for people who are outside in our society, not necessarily veterans. So this led to a lot of efforts, and our societal attitudes also started to change. And in the mid 70s or mid 60s, these advocacy movements around disability, they were also complemented by other social movements of that time. Those other social movements were for the civil rights, for the women's rights, for the labor rights. So a lot of movements were happening in 1960s and 70s. So it influenced governments thinking, policy making, and some of the milestone work can be recognized and is influential since then. So one was the United Nations Declaration on the Rights of Disabled Persons in 1975, and it influenced all the governments, including Canadian government. And this is section 15 of the Canadian Charter of Rights and Freedom was then clearly acknowledging disability as a ground not to discriminate anyone, and that was in 1982. So we are now moving forward. The society has embraced people can have visible, invisible disabilities, and we need to provide support systems for them. And now another big milestone in the recent years that has shifted our thinking to understand disability is the United Nations Convention on the Rights of Persons with Disabilities, 2006. And it says that persons with disabilities include those who have long-term physical, mental, intellectual, or sensory impairments, which in interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. And why this is important? The important is not only it is acknowledging different types of disabilities, physical, mental, intellectual, sensory, but it is saying the emphasis is on impairments and the interaction with various barriers. So this thinking is rooted in the social disability model. So what social disability model does is that it says that the impairment is actually not because of the individual disability. It is because of the inaccessibility in the environment. The problem is that our environments are not accessible and there are a lot of barriers. That's why we need to think about the environment where people with disabilities are living. So it shifted the medical model of disability. So, in the medical model of disability, often disability is placed and attached to an individual body, and most of the interventions and programs are focused on the individual. And now this thinking which came and is embraced by United Nations is the idea that you can change the positive or negative experiences of impairment if you have a very receptive environment. So we need to think about environment along with that, individual impairment. And because of that thinking, people started to examine, learn about the barriers. And this has also given a lot of attention and light to the barriers which are experienced by family caregivers. So today's session is about family caregivers. So I would like to share some of those experiences. So in the recent, last year, I got a chance to review Canadian studies conducted with parents and family caregivers of children living with autism. And these were 25 years that I examined. And across those studies, I have found these themes that parents and family caregivers are handling many things. First, they try to learn how to become a caregiver because caregiver role is on top of a parenting role. So they need to learn what is this diagnosis, how can I get more information about care programs. They want to connect with families, learn from their experiences. They learn how to communicate with professionals because many times they use technical language. They want to have family-centered, child-centered care programs. And then they take on many caregiving activities. They learn how to, for example, implement some of the behavioral interventions with professionals. And also, they support child in many ways in learning the social communication part, physical activities, academic activities, arranging appointments, taking from one professional to another professional, talking to school teachers, and sometimes they change home environments for the safety of the child. Because autism is a spectrum and the needs can vary from mild, moderate to high. So they do a lot of changes. And then there were many studies talking about their journey of diagnosis and therapies for the child. So having the diagnosis of autism is a complex journey for them. Because sometimes parents don't realize the symptoms, teacher notice that, and then is a long waiting list to meet the professionals. Unless you can pay out of pocket and reach a psychologist, you are usually in a waiting list for up to 2 years sometimes. to get that professional diagnosis, and that diagnosis is needed to access the support services. Then they search many therapies, and you, as some of you already know, that autism uh, is unique to each individual who is living with it. So the type of professionals and therapies which they seek for their child, they vary. Sometimes they are talking to a developmental pediatrician or psychologist, psychotherapist, speech language pathologist, physiotherapist, occupational therapist, teachers. So, and that variety of professionals and the needs of the child also change over time, also add more stress, and sometimes they feel overwhelmed. And this is, the focus of our today's talk. So I just wanted to share autism as an example, where, how caregivers are experiencing the caregiving. And most of the time, the caregivers are parents, and 90% of the time, studies are showing that these are mothers. Although there is a positive side reported in the studies, they share personal growth by having a child, in the family with disability. They develop advocacy roles, become leaders. They become more resilient. They want to address stigma attached to disability, but at the same time, a large proportion do experience mental health stressors. So I just want to also add to this element that these stressors are not just individual and family level. The extent of stressors also varies from community to community. For example, uh, it can vary, the type of income you have, how much education you have, whether your province have high level of funding, whether you have supportive school systems or healthcare professionals, whether families have language challenges, barriers, they are newcomers. So the extent of the caregiver experiences, they vary, and today we are focusing on the Asian communities. So I just want to highlight that we need to keep in mind that the challenges are often higher for communities which are either low income, they are newcomers, or they are racialized. Because generally, this is what we are seeing in the literature, they have higher levels of barriers to access program services or developer understanding. Sometimes there are culturally based elements. For example, stigma could be high in one community. So scholars have thought about different ways to understand coping for parents, and this model is from uh, Adrienne Perry. She's a professor at George University, and this model she has developed, especially she was working with the families having children with autism, but this is applicable for families having different types of family members with disabilities. So the idea is that on the one side, you are seeing a lot of stressors. Stressors can be related to the impairment that the child has, the level of the needs and supports, and their own other additional life stressors. And then the outcomes can be negative, or they can be positive for parents. But what determines is important, which are really resources and supports. Whether families have support systems, whether individual has personal resources, they have the language skills, they have the knowledge, they have uh, maybe a higher level of income to access private support services, whether they have extended family around them, they have friends who can help them. It also, so informal social support, and also formal support systems, all the accommodations in the school system, the therapist. So all of that together, they are the one which actually determine whether parents and families are experiencing burnout or mental health conditions, or they are resilient, they are able to cope. So keeping that in mind, um, this has given us an understanding that the mental health conditions or the burnout that families experience, it is not something that our individual body is lacking something. No, it is nothing about that. It is about when the stressors become so much that they cannot cope, they go beyond their capacity, beyond their resources, that they experience the burnout and a mental health uh, conditions sometimes. So I just want to highlight this to make sure that we understand this has nothing to do with weaknesses in our body. It is about the environment and the resources available to us, and we can become more reflective and pay attention to that. So, what is a proactive approach then? When we already understand that family caregivers are vulnerable to experience mental stress. So, I think one important way is to identify symptoms and signs of those stressors. How are they affecting your mental health and well being? What type of self-care approaches are available? And when you think it is going beyond your self-care approaches, then approach a professional in a timely manner. So we need to be very reflective and embrace some of that understanding, because there is a back and forth relationship between the child well-being and the caregiver well-being. And there is strong evidence on that. When caregivers feel stressed or they have depression or anxiety, the type of caregiving they offer to the child also goes down. So, in order to take care of our child, which we know is so important in our Asian communities, we are family oriented, we are collectivist, we put a family in front of our career and our personal inspirations. But we need to understand that that goal of the child health and well-being cannot be achieved when the caregiver themselves are feeling down. So, so it is not being selfish if we think about our mental health. If we do something for ourselves, it is not being selfish. It is to be more proactive and continue our life in a balanced way. Um, so, burnout is, as is defined by American Psychological Association as physical, emotional, or mental exhaustion accompanied by decreased motivation, lowered performance, and negative attitudes towards oneself and others. And burnout is not a medical condition, it is driven by long periods of stress. When someone is having long period of stress and they are not giving enough time to themselves to recover from the stress, and how do those periods of stress become long? For example, they can be too much work in your workplaces. It can be too much studies, or it can be too much caregiving, because caregiving is also work. And it can induce stress if we are not paying enough attention to ourselves. So, what are some of the common symptoms? Fatigue is one. You might be sleeping too much or having lack of sleep. You might not feel interested in doing different stuff, your work or other activities. There can be mood changes in such a way that even minor stressor can lead to anger outburst or you become very irritable. There can be changes in eating, style. There can be tension, headaches, and there can be physical symptoms as well: back pain, body pain, gastrointestinal issues. And it is really important here to acknowledge and that in some cultures, people are less expressive about their mental health. And often the stress is experienced as body aches and pains. And this is what me and Dr. Fung examined few years ago for the Chinese community living in the West. That no matter you have been here for several years or you are newcomer, there are some cultural components which continue from one generation to another generation. And there's a tendency that when they reach the professionals, instead of saying that I am feeling low, they may say, I have body aches. And we call it psychosomatic expressions of stress. And that is also important to realize, and many professionals have become aware of it. But you, as a community, I think we need to realize that stress is not expressed the same way across different communities. So, what can we do to prevent the burnout or recover from it? Some of the tips given by professionals are: think about breaks in your day in a strategic way. Am I feeling emotionally or physically tired? Caregiving is can be overwhelming, right? Uh, and also establish some boundaries between your caregiving and your personal life. Is there time for me to do something for myself? And make it a routine. When do I sleep? When do I eat? Where is my time to socialize? Make a phone call to a friend or, your siblings. Try to make it a routine so you can have a little bit of a balance and move away from continuous work or caregiving. You can practice mindfulness. Uh, Mindfulness is this deep breathing meditation and to stay grounded in the present moment. And there are many, many examples. I'll share some resources. You can think of doing some physical exercise every day, going to a gym 2 times a week, doing a walk, so you need to create that balance among the family members. Maybe if mother is the primary caregiver, they can ask their spouses in the evening, I need time for myself. I want to go for a walk. So that is important for the whole family, the both parents and supportive family members to understand that the primary caregiver needs to have these small steps in their life for their self-care. We don't want them to feel burnout. Also, try to identify hobbies and any other social connections, volunteering that may add fun in your life, some relaxation. And also, you can approach a therapist. What are therapists doing? You can learn self-care from them. They also give you a safe space to talk about stressors. There might be some challenges that you don't want to talk to other people in the family, but and you can share them with therapists, and that is also reduces stress. So as I said, having supportive networks, either formal networks or family members around you, are very important. So I brought some examples here. There are some programs run specifically for family caregivers. So one is CARES program. It's also in your resource list. It's offered by SAC Autism Center. It's an 8-week program for counseling, and ACT is also available for caregivers. There are mindfulness resources, established resources. Some of them are apps, and some of them are audios, and they are recommended by Canadian Mental Health Association, and some specific groups and helplines. Spiritual faith can also be important, and I would leave that for Dr. Fung to talk about it. That's one of his areas as well. So now I would like to hand over to Dr. Fung, and he can share his perspectives and knowledge about anxiety, depression, and how to handle some of those.
Thank you, Professor Mac. I guess before I go on, I just wonder actually whether people have questions that they may want to ask at this point about what Professor Mac, had presented.
Yeah, that's a great idea.
Sorry, I'm here. Yeah, I let me collect a few
Mhm.
questions and then I'll put them in the chat, okay?
Mhm.
Okay. Okay.
Okay, let's start with the first one here. So sometimes I find it's hard to accept that my child has challenges. I often prefer to handle everything within my family rather than ask for help. But there are times when it feels overwhelming. I also worry that if others see my child as different, they might face judgment or discrimination. How do other parents cope with this feeling? This is a very good question, important question. We touched base a little bit on this on Monday when we were talking about how to navigate the education system. But please, Alan and Farah, if you had
Yeah.
any thoughts to
Yes.
add.
Yes. So I would say that, um, I have also seen stigma in some of the research, and it puts families at a disadvantage. Because then they are not sharing their experiences with sometimes even siblings, the child's grandparents, because they are worried about stigma. But then they become isolated in return, and that isolation is a burden for the caregiver, and you might not be able to maybe gain some additional knowledge. Therefore, in the big picture, parents are trying to connect with other families who are having these experiences, and then they can share directly their experiences with other families having similar experiences. That's where stigma, at least in the beginning phases, it dissolves, because other families are also having same challenges. So those support groups are really important, because those families are having same challenges. We have a lot of caregivers programs. Sometimes they are for people living with cancer, people living with Alzheimer, and then there are caregivers program for families having children with disabilities, intellectual disabilities, developmental disabilities. So the one first step is to meet those parents, share with them, and that will start to dissolve some of the stigma, and you will learn from them. That's the first step, because in the long term, that stigma and isolation, it is a disadvantage for the caregiver and the child. Ellen, would like to add something?
No, I'm in total agreement. I think having the opportunity to speak and connect, with other caregivers, I think would be very important, so that people know that you're undergoing very challenging circumstances, but you are not alone, and you are not the only person who is going through that. So having that connectedness with others would be really important.
Yeah.
And of course, other audience, in this webinar, please feel free to share your perspectives.
Yeah.
I guess that we're back to what we talk every single night, the importance of parent networking. every single day, regardless if we're talking about education and employment, that always come back. That's a very important. And okay, so now we do have another question. I'm going to write it in the chat. It says between work and caring for my child, there is very little time left for myself. Most days it feels like I'm just trying to get through. How do other parents find time for self-care or rest in such busy schedule? Very similar, but
Yeah, yeah. I think other parents who are here, they can also jump in. But I would say that, you know, it negotiating with other adults in the family is really important. You can take turns that, Tuesday evenings, I am the primary caregiver. Wednesday, it is another adult family member who is the primary caregiver. So sharing the caregiving among adult family members is very important so that it is not the sole responsibility of one person. I think we need to think about that as well when both parents are working. Then, the caregiving uh, needs to be shared as well. Other could also be, respite care. I don't know if you are aware of, there are programs available. Some support is funded by the government. So, who are the people who would come and give you a break from caregiving. So, talk to your professionals, healthcare professionals, or service providers how to access respite care, which is funded by the government.
Absolutely. And it's really important to keep in mind what Professor Ahmed, had mentioned. You can only care for your child if you're well. So you need to actually first make sure your well-being. So being able to have time to stay well is really important for taking care of your children. So that's really important.
thanks, Alan. I'm
Yeah.
smiling because again, this is something that come back every single session.
Right.
Think of yourself. You have to be in a good place in order to take care of someone else. And because what we learn is that this is for all parents, for all caregivers here. What we learn is that parents of kids with disability become the best education expert, best doctors, best HR expert for their kids, and so that's a lot of stress on them. Yeah. Okay. So last question before we move ahead. Okay.
Good.
As my child gets older, I find myself worrying more about the future. Even though we actually learned yesterday about this as well, about ways to support independence and employment, I still worry about what will happen when I'm no longer around. Do you have any advice for parents dealing with these concerns?
It's a very
We can
good
talk for an
question.
hour now. Okay.
Yeah, I know. And you just had the yesterday session, right? So I know you will put videos at some point, So maybe parents who are here, families, and they couldn't come to that session, they can watch that conversation about resources around finances. Yes, this is a growing concern, and it is present for complex disabilities as well, because as I said, we are embracing diversity and disabilities in our society. Our technologies have improved, our support systems have improved. Now we are seeing, people with disabilities reaching universities. So now universities have to handle that. So now some of the parents are now seeing that now they are aging. So what would happen to their children who are adults now? Yes, planning ahead of time is very important, transitioning So a lot of emphasis up till now has been transitioning from kindergarten to school, then high school, and high school to university or some internships. But there has been less focus on the adults living with disabilities. I think we need to pay more attention. For advocacy is really important, so the government support systems can be enhanced. They are not that strong. So now it falls on the families to make a planning. I attended some sessions as well around that, and some families are developing trusts, that where their inheritance can go, and then there's a trust who would use the generated income to support the child in case there are no other family members. So there are some specific legal systems and companies, I would say, they are supporting the families to make a plan, a long-term plan to support their child in case parents or other siblings are not around. So you should look into that and ask those questions to the caregiver agencies you are meeting.
Absolutely. And I think I totally agree, advocacy work is really important. I think in the field of intellectual and developmental disabilities, places like Surrey Place Center would be really important partners. So like in terms of supporting adults with intellectual developmental disabilities, so definitely, need ongoing conversations and raising awareness, because I think a lot of attention placed on children and adolescents with disabilities, but definitely not on the adults, and even much less on older adults. Because
Yes.
nowadays we actually have many people with disabilities who are living into older ages. My clinical practice is on older adults and seniors, and we are actually seeing more and more people with different types of disabilities in our population. So these are really valid concerns. And I think that question is actually a pretty natural lead in to the next part of our seminar, which is to talk about anxiety and depression. So I'm just going to continue the presentation, and then after my part, we can have more Q&A time. And so far I had talked about burnout, like caregiver burnout, caregiver distress. Sometimes people may actually have more than just burnout, and things may worsen to the extent that it actually becomes disabling. It can become a disorder. So what's anxiety? So anxiety disorders are actually common mental health conditions that can involve excessive fear, worry, or nervousness that interfere with daily life. So that's a key point, because many people would say, okay, everyone would experience anxiety at some point, which is true, right? It's a normal part of life. But when it becomes interfering with your daily life, and you feel that it's hard to control, and it affects your relationships, your work, and your overall well-being, it may become a disorder that may require professional help. Now, these conditions, anxiety disorders, are among the most common mental health disorders across the lifespan. Some estimates even say that up to 1 in 3 people may experience an anxiety disorder at some point in their lives. Now, I also want to mention that anxiety is different from fear. So fear is a response to an immediate threat. Like, if you actually see a bear, there's, an immediate threat. But anxiety is more about the anticipation of a future concern, like, worries about your child, worries about finance, worries about your health, for the future. So it's more the anticipation part. Anxiety is often associated with muscle tension, avoidance behaviors, whereas fear is often linked to a fight or flight response. Now, so what are some common symptoms of anxiety? There are many different types of anxiety disorders, and they can have different symptoms. But broadly speaking, there are several dimensions of the anxiety. There could be emotional symptoms, meaning the feeling part of the symptoms. So persistent worries or fear, feeling on edge or feeling restless, difficulties concentrating on things. There could be physical symptoms like rapid heartbeat, feeling short of breath, muscle tension, feeling fatigue, or having sleep problems. And there could be behavioral symptoms like avoiding the feared situations, needing to seek reassurances, and having difficulties completing the daily tasks. So when someone actually have these symptoms that are out of proportion to the situation and are persistent and are interfering with daily functioning, they may actually have an anxiety disorder. And these disorders can happen across the lifespan. Some people may have anxiety disorders beginning in the childhood. Others would emerge later in their lives. So I also want to mention that some caregivers, they may develop anxiety disorders, but people who already have anxiety disorders, when they actually also become a caregiver, they are at even higher risk for having severe symptoms. Before I talk about what to do with anxiety disorder, I also want to mention about depression. So depression, or here we are talking about the most severe form of depression called major depressive disorder, is also very common and a serious medical illness that will negatively affect how you feel, think, act, and perceive the world. Meaning that you look at the world with a very negative lens. Symptoms of depression can vary from mild to severe, and they may appear differently in different persons. As Professor Ahmed had mentioned, in the Asian population, very often these depression symptoms may manifest in the form of body ache, fatigue, sleep problems, etc. Now, a similar question to anxiety. Some people would say, okay, everyone will feel sad at some point. How do we distinguish between normal sadness and depression? So the way how we would distinguish, sadness from more severe depression would be the severity, persistence, and the duration. So, for example, when we feel disappointed, we might feel sad. When we have a loss, we might grieve. But these feelings would usually come and go. Whereas depression tends to feel very heavy, constant, and it's really difficult to cheer the person up. In the medical world or the mental health world, we have something called the DSM, also known as the Diagnostic and Statistical Manual, which is a formal classification system of different mental disorders. And this is how we would define major depressive disorder. So I'm listing some of these symptoms. So feeling sad, irritable, empty, or hopeless, losing interest or pleasure in things that you used to enjoy, changes in your appetite, either eating too much or too little, or weight changes, sleeping too little or too much, decreased energy level, increased restlessness, or much slower in your movements, feeling worthless or guilty, having difficulties concentrating or thinking, or even having thoughts of not wanting to live, having suicidal thoughts, or even suicidal attempts. So in these 9 areas, if someone actually has at least 5 of these, including the low mood or the low interest, and if these actually persist for more than 2 weeks, then the person may actually have what we call a major depressive episode, which is also how we define a major depressive disorder. So the point is, if your distress actually becomes, so severe that you're experiencing, a number of these things, you really need to talk to professionals. The first point of contact usually is your family doctor. So treatments for anxiety and depression. So as I mentioned, seeing your family doctor is the first step. Your family doctor can rule out any medical conditions that may cause these kind of symptoms, and a diagnosis of major depression or anxiety disorder would be made by a qualified health professional. And it's important to emphasize that anxiety and mood disorders are highly treatable, and many people improve with appropriate care. So you might ask, what are ways to treat these conditions? And there are actually a variety of approaches, often used in combination. So psychotherapy or talk therapy is very common and effective. Medications would be actually necessary in certain cases, especially more moderate to severe cases. Mindfulness interventions, exercising, lifestyle modifications, these are all important. And also something called neuromodulation that I'm going to comment on in a minute. So first, psychotherapy. So there are actually different types of psychotherapy or talk therapy. But for anxiety and depression, mood disorders, a very common type of therapy is called cognitive behavioral therapy, also known as CBT. It's a first-line treatment for these conditions. And the idea for CBT is that the way how we think would affect how we feel. And it could also affect how we behave. So if we can actually identify certain unhelpful ways of thinking, what we would call cognitive distortions, it may actually help us to reduce negative feelings. And in turn, it may also modify our behaviors. So as you read here, CBT can help us to identify these unhelpful thought patterns and help us to build coping skills around these situations. So that's one very common type of therapy. But there are also other types of therapy, for example, interpersonal therapy, which focuses on how interpersonal relationship issues affect our mood. Other types of therapy, psychodynamic therapy, emotionally focused therapy, these are all different approaches. And psychotherapy can be done on a one-to-one setting, but it can also be done in a couple or family setting or even group setting. And there are also self-help books that some people would choose to use to help with their own mood and anxiety issues. Now, psychotherapy can be very helpful, but in more moderate to severe cases, we often would need the help of medications, what we would often call antidepressant medications. But I often tell people that antidepressant is a misnomer because these medications are not just helpful for depression. They are also very helpful for anxiety and also irritability. So nowadays, some very commonly used first-line medications for these conditions, they are the SSRI or SNRI medications. Without going to the details, these medications, they mainly work on a brain chemical called serotonin. By increasing the level of serotonin in the body, we found that people would actually have less severe depression, less severe anxiety, and less severe irritability. And it's important to mention that these medications are often used in combination with psychotherapy. And I want to, just mention a few things because often people have a lot of concerns when we talk about medications for mood and anxiety issues. So first of all, these medications, they are very safe. They are not addictive, and people usually don't need to use them for life. And there are, some side effects with these medications, but generally speaking, very well tolerated and very safe. So this is not a talk, focusing on these medications, but I just want to mention that if needed, these medications can be an option in reducing severe anxiety and depression. Now, I also mentioned about neuromodulation here. What do I mean by that? So for more severe patients, often we would need some intervention like electroconvulsive therapy to help to treat the severe depression that may not respond to medications or psychotherapy. Now, there are a lot of stigmas around the use of, for example, electroconvulsive therapy or ECT. But I just want to mention that nowadays, ECT is done in a very humane way and is also very safe and very effective. And other than ECT, there are also other types of neuromodulation, like what we call transcranial magnetic stimulation and other treatments. Again, this is not a talk focusing on any of these, but I just at least want to mention these are actually very safe options. And of course, lifestyle interventions would be really important. For example, physical activities and exercising, really important. And it's so important that I often would tell patients that exercising is actually part of the treatment plan. It's not just something good for you. It's actually a part of the treatment, just like taking medication or seeing a therapist. And there are actually many research studies that's demonstrated that exercising alone can help to reduce mild to moderate depression. And also it helps with sleep. And sleep problems are often coming together with anxiety and mood problems. So having adequate sleep is really important. And this is especially an issue in a lot of caregivers because of a lot of times, because of the caregiving duties, many people may not have enough sleep. You really need to have that adequate amount of sleep. And even for adults, an average to 7 to 8 hours per 24 hours period is really important. Okay. And Professor Ahmed had mentioned about mindfulness. That's also very important. So mindfulness is the concept of focusing on the present moment rather than the past or the future. Because if you focus too much on the past, you might feel sad or regretful about what had happened or not happened in the past. If you focus too much on the future, you might feel worried or anxious about the uncertainties. So mindfulness is the idea of focusing on the present moment. And how do you do that? There are different ways. For example, breathing exercises, meditation, or even, nowadays people talk about mindful walking, mindful eating, things like that, and relaxation practices. Later on, if we have more time, we can go through some relaxation practices as well. Limiting caffeine and stimulants, very important. If people are already anxious or having sleep problems, you really want to minimize anything that would interfere with sleep. Joining support group, Professor Ahmed had already mentioned the importance. And nowadays, support groups, can be in person or online. Community involvement, very, very important. Is the concept of the connectedness. So many caregivers are really focused on their children, understandably. But sometimes if we focus too much, or if our children are so focused, we may be going in a downward spiral. So sometimes it's actually important to have some outside involvement so that you are distracted from just focusing on your child. And a related thing is actually spirituality and or more broadly meaning finding. Now, when I mention about spirituality or meaning finding, it could be pursued through religion, but it could also be pursued outside religion. Regardless, I think everyone can or should actually have time to find meaning, especially in caregiving. I think finding what does the caregiving mean to you is really important. And, for people with anxiety and mood problems, it's important to learn about your condition to better manage the symptoms, knowing about the different treatment options, the benefits and side effects. Very important. Definitely talk to your family doctor and or psychiatrist and other specialists about any concerns. Now, definitely yoga and other things, can be helpful, but they should not be used alone. They should be used along other evidence-based treatments, for example, the psychotherapy and medications, etc. People often ask about, whether supplements might be helpful. My answer to that is there are some supplements that may help, for example, with sleep, melatonin sometimes can be helpful. With anxiety, some people have found valerian root to be helpful. For mood issues, some people have found St. John's wort to be helpful. But my general recommendation is that start with exercising and also mindfulness practices and also psychotherapy and medication as needed. I think that's the best bet. I put down beware of excessive screen time because often when we are stressed or depressed or anxious, we may not want to, spend time with others, and we may be spending a lot of time on the screen. There are pros and cons. As we know, ChatGPT, or AI nowadays have become the therapist for some people, which there are pros and cons. But I think it's really important to limit excessive screen time and have contact with real people. And the last thing, respite if possible. Professor Ahmed had already mentioned the importance, taking breaks if possible, taking turns in sharing the responsibilities with family members, also really important. With that, I'm just going to stop share and see if people have any questions or thoughts.
Alan, we actually received one question. It's in the chat. How do we determine when medication is necessary and when other intervention may be sufficient?
Yeah, that's an excellent question. So the key thing is one is the severity. So as I mentioned, very often people start with the non-medication ways. So they would try to like some people they already try to do exercising. They try to practice relaxation, and they may even be seeing a therapist. But despite doing those things, the mood or the anxiety issues might still be very severe. That would be really the point to talk to your family doctor to see whether treatments like medications would be important. And I would say, especially if people have changes in the performances, like for example, they don't want to work anymore, or they have actually lost the motivation to care for the child. Like these would be important signs that maybe actually the depression or anxiety has become so severe that medication would be necessary. And one more thing I will mention, because I've actually had patients with these issues, some people may actually develop suicidal thoughts, or sometimes, unfortunately, even thoughts of hurting the child, because they feel that they can no longer care for the child, and so they want to actually die, with the child. So these are emergency situations that actually would warrant presentation to the emergency or calling, the police. So unfortunately, these kind of situations have happened not uncommonly. And I see that in the chat. There is a question of one of the
There is another question. Yeah. One of the common signs of depression is low energy and loss of interest. How can we tell the difference between depression as simply being exhausted or burnout from long-term stress and caregiving responsibilities?
And that's an excellent question. So
Can I also add one thing?
Yes, yeah.
Also, when can we tell the difference if as depression or if the tiredness and the lack of interest or getting easily angry is because of thyroid issue?
So that's excellent. That's really excellent. So that's why, when I mentioned about the treatments, I mentioned that first of all, you should talk to your family doctor, and then the family doctor often would actually do some blood work to check, for example, thyroid, because Elena had made an excellent point. Low thyroid can actually lead to depression and fatigue, and sometimes high thyroid can actually lead to anxiety. And so are some other medical conditions. So it's really important to check if there is a physical cause for these kind of symptoms. But it's true, sometimes the lack of motivation that we see in depression may be difficult to distinguish, from the physical exhaustion from the long-term caregiving responsibilities. So that's why, maybe as a first step, because the treatment for burnout is not medication. The treatment for burnout is actually respite. So maybe, if possible, taking some respite, taking a short break if possible, and see if these symptoms would improve. Because in the case of major depression, unfortunately, even after taking a break, the symptoms will still often persist. And then, we know that we are dealing with more than just burnout. We are talking about like maybe a major depressive disorder that will warrant treatment. I don't know if, Farah, you have additional things
Yes.
you want to add?
Yeah. No, thank you. Exactly that. That burnout is a situation where you remove the trigger, then, burnout will go away. If the workload was too much at your job and then the workload is gone or you go on a vacation, the burnout will disappear. Uh, but in case of major depression, it would stay.
Exactly.
So that's the difference.
Exactly.
Um, Thank you. We do have a few more questions. Do you want to go ahead with questions or should we have a break now?
I think we can go ahead with the
Okay,
question.
perfect, perfect. Yes. All right. So let me put it in the chat. Uh, okay. Thank you, Dr. Thank you, Farah, for mentioning trust available for adults with disabilities. Could you tell us a bit more about how these programs work and how family can start planning for our child earlier?
Yeah. Okay. So I think I would, as I was saying, that I learned about that myself by joining some sessions. So the invitations were coming from the CTN, the Children Treatment Network. So I think the best is the professionals who are working in this area, because I'm primarily a researcher, but I know there are trusts there. I can dig out the names and maybe can share it with Elena and she can distribute to the participants. But there are legal groups who are working especially with families, having now adult children, adult individuals with disabilities, and they are developing those strategies because they know they will not be there forever for the child or adult. So I'm sorry, I don't recall the name, but there are groups like that. And I can dig out and share it with Elena to distribute in the groups later on. But
Yeah,
the
that would be
kid,
great because
yeah,
after the session, when we distribute the video and the resource sheet, then we can add this
yeah.
information. Mhm. Sorry, give me a sec. Keep receiving question on the side. All right. So here, um, counseling and therapy are often encouraged in Canada. But as parents, we're focused on meeting families' day-to-day needs and not unsure whether professional mental health support will be helpful. Could you elaborate on the benefits of seeking professional mental health support? We already discussed a little bit about this, but please give more details,
Yeah.
maybe.
So I'll take a step on, at that question. So yeah, this is actually a very common question, because people might say, "Oh, I have families and friends to talk to, so why do I still need to see a professional?" Now, so here's the thing: for some people, actually, by talking to their family and friends might be sufficient, and so for those people, it's true, you may not actually need to see a professional, but uh, there are also many people that, despite talking to their family and friends, they may still feel very anxious and burnout and down. So that's why it's not a one-size-fits-all, kind of recommendation. It's really for people who feel that they would benefit, from seeing professionals. They might want to do so. The other thing is, even though family and friends, they could be very helpful and they may be willing to help, but very often, because they are not trained as professionals. So if you keep talking to them about your burdens and things like that, over time, many family and friends may actually get burnout, from being the listener, because their role is not your therapist. Their role is your family members or friends. So that's why we've also seen that it may not be a long-term option for many people. And so that's why seeing the professionals is beneficial, because these are trained people and this is their job, so they are there, they have the expertise, and they are in a position to support you. And also the information would be confidential, so that's another part, the confidentiality is an important part. I don't know if Farah, you have other things to add.
Yeah, exactly. I would say that, emotion is contagious, right? So that's where our family and friends, their support becomes limited for long-term basis, because when we watch some sad stories, sometimes there are tears in our eyes. Emotion is contagious, so if we keep sharing our worries about about our caregiving, etc., with one friend, two friends, they may feel emotionally drained and sad as well. So for long-term basis, I think talking to a professional is helpful, and they just create safe spaces. That's all. It is our own. I think generally in some community there's own invention that there is maybe some weakness in our mind, and people will see we are weak. That's why we are going for counseling. No, they just create safe spaces which we can access for a long time. So that's why professional support is important, especially when caregiving is an ongoing activity.
Thank you. And I do have a perfect question following this that we just mentioned, saying that could you please share any mental health support services or parent groups that are familiar with the cultural background, that are more cultural focused and specific needs of Chinese Canadian families who have children with disability?
Yes, yes. So that is something that is, I think, still growing in terms of the addressing the need of the diverse communities. But for example, if because disabilities can be of a different nature, but I can share, for example, one for families having, children or individuals with autism. That SAC is a center, autism center in Scarborough. They have developed and they have tested a program called CARES, which is for the diverse communities. I think they offer those sessions and they are funded by the Ministry of Children or something. So those were included in the slides, and that example is included in the resource sheet that was shared by Elena. So that's one example. And for the Chinese, I think Hong Kong is doing something, but maybe Ellen, you can share some more examples for.
Yeah, so exactly. I think certainly there's not sufficient of these services, but Hong Kong, they or now they changed their name to HF Care. They can provide some of these supports. There is uh, um, something called they used to be called Chinese Family Services of Ontario. I think they had changed the name to Community Family Services of Ontario, CFSO, that would actually offer um, um, some counseling support for people that people may not need to pay. And there are some what we call GP psychotherapy clinics that would offer talk therapy services that are covered by OHIP. So, for example, there is a clinic called the Grace Health Center in North York that would offer this GP psychotherapy service. And then there is another one called the Medical Clinic for Person-Centered Psychotherapy. So the first one I mentioned, Grace Health Center, they do offer services in Cantonese and Mandarin. The Medical Clinic for Person-Centered Psychotherapy, they may not necessarily offer services in Chinese, but these are all, psychotherapy services that are covered by OHIP because they're offered by medical doctors. So I think the big picture is there are some of these supports, certainly not enough. We realize that.
Yes, not enough. And I would say that, going to the support groups for the families, that is a key resource of information. You will learn a lot from the families, especially when they are around a specific type of disability. Then, because they have gone through or they are just starting. So, parents and families, they learn from each other a lot about those resources. Sometimes it takes, because they are not in abundance, there are not a lot of them, so searching them through website is not an easy job. So families are a big support for each other to share those types of resources as well.
And I think there is a question on any services in Greater Vancouver area. Yeah, unfortunately, I'm not very familiar with that, but I think Vancouver Coastal Health, they have a mental health program called Generation Health Clinic that would offer some services in Chinese. But I don't know the details of that. Yeah.
Farah, you were muted.
Okay, the overall BC government has done a lot of work around mental health support. So in the resource that was shared, there is one site from the BC government, and they have a lot of like audio files to do different types of meditations, breathing based and body scan, and you can just listen to the audio and just follow the steps. So BC government has done a lot of effort. So I'm sure there are other resources, especially for culturally, sensitive and practices. It's a matter of just searching, but I am myself not familiar.
We do have one more question. I'm going to put it here in the chat. Dr. Farah Ahmad, you mentioned that funding support for adults with disability can be limited. Why do you think this is the case? And as parents, what are some simple ways we can get involved in advocacy and help create change?
Yes.
We discussed this a little bit yesterday, but maybe if you can give us more information, that would be great.
Yeah. I think this is all about advocacy because the history tells us that parents and families, individuals living with disabilities, they have brought a lot of changes in the funding, programs. Sometimes they were fighting through court systems, and sometimes it was advocacy has been through media rallies as well. Uh, really, why there is less attention to adults living with disabilities, that is a big question. I think as I said, for a long time, people probably didn't think about the number of years people will live with disabilities. Now that our society, our support programs, healthcare, etc., has advanced a lot, so they are living many years. Now we are concerned about their quality of life, right? That they are adults, they are living longer, so let's make sure they have good quality of life. And that's where the policy making, which is the funding part, is lagging. It is still focused on the, from children to 18 years and then 21 years, which is the school system. So families are, many families, they struggle when the children are done with the high schooling, maximum 21 years. And now I know through research, some families, they give up their jobs because now the adult family member is at home 24 hours 7. And now someone needs to be there to take care of them, and they may get some respite care, but that's not enough. Sometimes they are adult day programs where their family members can spend few hours, but often they are also limited, and there's a wait list there. I know a family who has found only 2 hours in a week for their adult, family member, for the adult child. So they are really not enough for the adults, even and the adult day centers, many of them have been developed by the not-for-profit organizations. Either they started because of the religious groups. Some were started through the church group, or I know some were Muslim groups, some were Jewish groups, and they have developed these day centers, and now every year they apply for funding. So their programs are not growing. They are not for profit sectors. So that's another challenge. Why cannot it be government based? Very few maybe adult day centers. So that's the, I think, challenge, and that needs advocacy for sure.
Thank you, thanks. And there is one person who left a comment. It's more a comment. I think one of the biggest barriers for many caregivers is the feeling of shame around seeking professional help. Before we can receive support, we often need to let go of the belief that asking for help means we're weak or failing. And then I actually just received a question which follow these comments perfectly. It's for Alan. Alan, do you think the increase in adults seeking mental health support is due to reduced stigma, or are there other reasons as well?
I think that's an excellent question.
Because you mentioned this before when you were talking. You said like I see more adults now.
Yeah. So I think in general, I think we are seeing more people willing to seek mental health support, because I think compared to, let's say, 20 years ago, there is somewhat reduced stigma on mental illness, or seeing mental health professionals. Having said that, of course, there is still a lot of stigma compared to physical illnesses. So I think we are still having the stigma issue, but much less, than, or significantly less than before. But I think what we were talking about in terms of seeing more adults and older adults with disabilities, we are mostly referring to the fact that a lot of people with disabilities, they are living longer lifespan, that a lot of them, not only, would they live to adulthood, but also into older ages. So that's why we would also see them in the mental health system.
So I just sorry, cannot.
Sorry, Farah, you have any comments?
Yeah, no, I think it is, I think through the media, we have addressed some of that stigma as well. We share now information, the internet is there. We can meet virtually quickly, so there is more effort on the professional sides as well. And then the general media, everyone is accessing these days. So I think there is a growing understanding that, mental illness can be anything like a physical illness and it is addressable. So if we seek the support at right time, it can be addressed. So there is reduced stigma for that, but still in certain cultural communities, I find, or the newcomers come, sometimes they are hesitant because sometimes they feel the pressure that we need to be the best immigrant. If I go, maybe it will spoil the image of my community, that this community is weak. I think we need to get rid of that. When your own health is, strong, you are doing well, then everyone else in the community will gain from that. So we need to detach some of those worries that, if I go, my family image is affected, my community image is affected. No, you are healthy, you are a productive member, and that's good. It's for everyone's well-being.
I agree. And I think there is a comment in the chat that in the East Asian culture, asking for help is often seen as shameful. And I think the same can, go for, some other Asian cultures and, even some other ethnic groups as well. And so, so I think first of all, raising awareness of this issue is actually important. So we are aware that in certain cultures, there's more stigma or people might feel more shameful in reaching out. And so we just need to keep the conversation going. As I mentioned, compared to 15, 20 years ago, we definitely see less stigma in terms of asking for mental health supports and talking about mental illnesses. So we just need to continue to do that. And I do think that over time, the culture will gradually change. But it's a slow process.
It's a slow process. And also, I'm seeing the communication with among generations in a household. The younger generations are more receptive, and sometimes the
Absolutely.
conversations by the younger people are shifting the mind frame of the seniors in the family.
Absolutely.
So I think our children, for those who are from minority ethnic groups, they are also playing a big role, and we need to have open ears to listen to their perspective. Because for them, it could be very normal to go and talk about this, and for us, it could be a big thing. So if we listen, dialogue about it, I think we can have a better understanding that this is not something to hide away.
I think that's such an excellent point. I totally agree. I think like people who have like children, adolescents, young adults, who've grown up in a Canadian culture, it seems that they actually are much more comfortable talking about mental health issues, seeking help for mental health issues. So I think that is playing a big role, as Farah was saying, in changing the general perspective, in the immigrant families.
Okay, we're good with questions now.
Okay, good. So do we want to do a reflective exercise a little
Yes,
bit?
yes, yes, yes.
Okay. So let
Sorry, it
me,
took a little bit of time to go through
yeah,
all the
yeah, no,
questions, but I
no,
think it's very important.
yes. So let me bring my slides up. Let's see. Okay, so we were, mm, so we were thinking, I think there's not too much time for a break. We'll just continue. Because we have a little bit of a participant activity. And we thought that we can give you all few minutes to reflect about your personal experience or a family member experience or experience of a friend or client about caregiving to an individual who has disabilities, and think about what type of tasks they are giving to that family member, how those tasks might be impacting their life, and whether they are engaged in any self care, and how can we improve that self-care. So maybe take 5-6 minutes to reflect and about yourself or others, and then we convene again, and we would like to hear from you, and we will stop recording at that time. uh, and those who are comfortable, they can voluntarily share some of those ideas, and we can discuss. I think we will learn through that discussion a lot. So let's see, Elena, if we are taking the time, maybe we give 5 minutes.
Yeah, it's
And
8:40 right now, so
yeah,
let's come back at 8:45. And
yes,
when we come back for reflection moment, we won't record, so we'll stop recording.
yeah,
And yeah, and then we'll do the wrap up, and then we'll finish by 9 o'clock. Okay?
sounds good. Thank
Okay,
you.
I'll see you at 8:45.
Yes, 8:45.
We are back. Hope you had a nice break. I know it was fast and
Yes.
you had time to think. So now let's stop recording. Mia? So to think. Oops. Okay. Like uh, to like we start to think in a different way, like right? Like and then start to go outside of our tiny bubble of every day and see things from multiple perspectives. So I really appreciate that. Thanks. All right. So having said that, as promised, we're going back to our poll that we did at the beginning. I know that several people had to leave in the meantime, but let's try out. And Mia is going to share the poll in a second. And I appreciate if you can please let us know if your knowledge about our question. This was the first one, Mia. Oh, sorry. Yeah, you're good. You're good. Yeah. Okay. So we'll ask you a few questions. The first one is, how much did the session improve your understanding of stress and burnout in caregivers? From 1 to 5, please let us know your thoughts. And second one is, how much did the session help you learn practical strategies for coping with stress and building resilience? Guess tonight we'll all sign up for yoga. And how much did the session, I'm joking. How much did the session improve your understanding of how community support network can help caregivers? Please do not be shy. Let us know how the session helped you, because this also will help us to organize other sessions in the future. I'm going to keep the poll open here. But for now, I want to say thanks to Farah and Alan for your time. Important reminders, the video and the resources will be shared on the North Star website. And if you have any questions, feel free to connect with us directly. Alan and Farah already shared their contact information, or you can connect with me or Mia. And having said that, I want to say to all the individuals who join us every single night, thank you very much for being with us from Monday to Thursday, spending 2 hours with us and asking questions and sharing your experiences. And I hopefully start to reduce more stigma and start to help to create a better world ahead. Thank you.
Yes. Thank you. Big hand of
Thank you.
applause for all
Thank you.
family
Yeah,
caregivers.
That's right.
absolutely. Exactly. Thank you for coming.
Thank
Thank
you.
you. Bye. Have a good night.
Okay.
Bye.
Thank you. Bye.